Action.
Hi, I'm Erin.
And I'm Jaime, and this is our patient Sierra.
Hi.
We are pretending like she is a 67-year-old with a left hip fracture. She also has a previous history of osteoporosis. So we are choosing to use the walker because we're not sure of her balance, and due to osteoporosis being degenerative and progressive, then later she'd probably have to end up using a walker anyways. So, anyways, I'll demonstrate how to fold it to begin with. You can just push these buttons in, push, and fold in. Carry it, store it however you'd like. Pull it out, make sure it clicks and it's nice and locked. And you're good to go. Also, in order to adjust the leg height for your patient, I don't know if you can see it, but there's different heights here. And you want to make sure all 4 legs are on. You can move them up and down and make sure it clicks. Okay. Before you even meet with the patient, you want to see if you can kind of guess their height and possibly adjust it to what you would think that they would be at before you even see them, so you aren't having to do a lot of adjustments while you're getting them up. Also, anything else? Okay. So when you're fitting them to the patient, you want to make sure that the handles are right below their hips. There's kind of a bony part that sticks out. It's about at that location. You want their arms bent to about 20 to 30 degrees, and their wrists just kind of a neutral, natural position where they can be picking up the device. And I think that's all.
Yeah.
That's it. And I'm going to turn it over to Erin now, and she can explain how to use the gait pattern, or what gait pattern to use.
Yeah, so with the walker and her fracture, I'm going to use a modified 3-point gait pattern. I'm going to demonstrate it for Sierra, and just to make sure she understands and she can repeat it back to me as a patient, just so as a PT we know that she knows what we're talking about and knows how to do the pattern. So the modified 3-point, what's going to happen first is you're going to be pretty much weight bearing a lot in your hands, since she's just about toe touch weight bearing, means she can't put a lot of weight through that left side. So a lot of weight here through your hands. The walker comes first, and then her left, the injured leg first, followed by the right. So it's walker, step, step, walker, left, right, and walker, left, right. When she's turning, we're going to have her turn towards her strong leg, so that's towards her right side, and we'll demonstrate that in the walking pattern in a second. Does that make sense, Sierra?
Yep.
And you understand walker first, then left, right?
Mm-hmm.
Okay, awesome. So, getting her out of her wheelchair, we're first going to just swing the legs around, making sure the brakes are locked. So getting those clear and out of the way. She's wearing a gait belt. That just kind of helps us guard her and make sure she's safe. Slide the walker up close to the patient. I'm going to instruct her to scoot towards the edge of her seat, using her own arms to push up off of the chair. We're going to both guard holding the belt, guarding on the front of her shoulders. She's going to push up, weight bear on the right leg, grab the walker, perfect. And just check the fit here while the patient's standing and she's in good balance at this point with 2 people guarding. She has about the degree of elbow flexion here. And as she starts to go, she's going to do walker, left, and right. Great job. Walker, left, right. And right now we have a PT and an assistant on both sides. You can choose whether you want to do right or left, or on their weak side or strong side. Different books will tell you different things. I like to stand on their weak side where Jaime's standing now, because I feel like if they're going to fall, they would fall that way. So, but it's up to you and your preference. So as we make this turn, it's going to be nice and wide towards her strong side, towards the right.
You don't want her to pivot at all.
And you see it here from the back, we're just holding onto the gait belt really lightly.
as she progresses, you want to encourage her to put as much weight as she can through that leg, so it will encourage the healing process and getting her back to normal gait.
And then we're gonna have her back up to her chair, just the same way until the back of her legs, until you feel that on the back of your legs. Perfect. And then reach back with both your arms onto the hand rest and sit. Great job.